So this is the certain risk factors as defined by various literature and their odds ratio as well. You can see that the odds ratio is highest for the presence of invasive mechanical ventilation and coagulopathy. Complications we have seen in the initial slides. So the complications are mainly hemorrhage, need for transfusion. Very rarely it can cause perforation. Yes, death, mortality. The one thing we have to remember is the primary reason for death is not the bleeding because of the ulcer, because when the ulcer bleeds you can always transfuse the blood, you can resuscitate the patient. It is because of the underlying critical illness and organ failure rather than stress related mucosal disease, and there has been definitely increased duration of ICU stay. Now coming to the treatment of agents, what are the various pharmacological agents which you can use for the treatment of a stress related mucosal disease, and some of these agents you can use for your acid peptic diseases as well, which you can use it for the other causes of UGA bleeds as well. So you can use the proton pump inhibitors, you can use your H2 receptor antagonist, you can use agents like sucralfate, and you can use other agents. The first class of agents we are going to see the proton pump inhibitors. The interesting site of action is going to be this, which is your parietal cells. As you can see, this is the luminal side of the stomach, and this is going to be your interstitial side of your stomach. Secretion of H plus ions, which is the proton, the hydrochloric acid, which is the acidic content of the stomach. The secretion of H plus ions is going to be an active process. Being an active process, which is an energy dependent process, which requires breakdown of your ATP into ADP. So basically the proton pump inhibitors, it binds to this H plus K plus ATPase, and it prevents in the luminal side, it binds in the luminal side, it binds reversibly in the parietal cell membrane, it prevents the transportation of H plus ions getting delivered into the lumen of the stomach. This is how H plus proton pump inhibitor acts. What are the various agents available? As far as proton pump inhibitors is concerned, we do have pantoprazole, which is the most commonly used and most studied agents, and we do have other agents like omeprazole, lansoprazole, esomeprazole, and rabeprazole. These are the various agents available. Mechanism of action, so basically parietal cell, and the other thing you have to remember is irreversible binding, and the third one you have to remember is luminal site, fourth one you have to remember is H plus ATPase. So these are the four things you have to remember as far as the mechanism of action is concerned. Route of administration, rather simple, everyone knows you have enteral and IV administration. Adverse effects, yes, as far as ICU patients are concerned, you should remember two significant adverse effects. The long-term use of PPI, that is the long-term use of PPI carries two significant adverse effects. One is nosocomial pneumonia, the other one is incidence of Clostridium difficile. There are some other theoretical adverse effects as well. In case if you have been asked, you can have atrophic gastritis. A lot of malabsorption syndromes can happen because of decreased acid absorption. For example, malabsorption of minerals, malabsorption of vitamins. There has been decreased absorption of calcium, leading on to risk of fractures. There has been incidence of acute interstitial nephritis which can happen because of the proton pump inhibitors. There has been malabsorption of iron, leading on to iron deficiency anemia. So there has been a lot of malabsorption syndrome which can happen because of the long-term administration of proton pump inhibitors which can happen. Earlier, there has been a lot of interaction which has been suggested with omeprazole along with clopidogrel, antiplatelets clopidogrel, because of the enzyme CYP2C19. Clopidogrel is a prodrug. This particular enzyme converts clopidogrel as a prodrug into an active drug, and omeprazole inhibits the same enzyme. And the current studies, the effect of such an enzyme, influence of omeprazole on such enzymes and the effect on pharmacodynamic interaction is questioned nowadays. But nowadays the cardiologists are still sketchy and they started using pantoprazole, or they do go for the other proton pump inhibitors. So as far as the side effect profiles are concerned, as far as critically ill population is concerned, the two long-term side effects which we have to remember is, one is C. diff, the other one is nosocomial pneumonia. The mechanism we are going to see in the subsequent slides. The other rest of the side effects are fairly theoretical.